Hello, Assalamu alaikum, everyone. I hope I'm audible. All right. So today we'll be covering a very well requested topic, mastering the MRCEM SBA clever MCQ techniques that I believe actually work. And this is from somebody who's given this exam quite a few times. So I'm Dr. Tajwer Shaheryar, emergency medicine physician and founder of Golden Eye Nia. So over the years, I've helped many doctors prepare for this exam. And what I've learned is that success in the SBA isn't just about knowledge, it's about changing the way you think. What I like to just term it as exam thinking. Okay. So today, I'm going to show you exactly how to think like RCEM, how to break down stems, decode distractors, and choose the safest, smartest option every single time. So let's get started. All right. So the real game, the SBA exam doesn't just test how much you've memorized, it actually tests how you can apply that knowledge under pressure, just like in any emergency department. So every question stem represents a patient in front of you. So instead of thinking, what's the right answer? Start asking yourself, what would a safe emergency doctor do next? Okay. Once you start thinking like, RChem, you'll start seeing through the distractors immediately. All right. So you're not going to be then just rote learning. You'll actually be training your mind to, make a proper clinical reasoning and have an ED mindset. Okay. Now, predict before you peak. This can work in some cases, this might not work in some cases, but it just depends on how you look at it. But hear me out. So here's one of the most powerful habits. Read the stem only first. Okay, hide the options and try to predict your answer before you look down. Why? Because one, it will force your brain to reason clinically, okay, rather than just pattern match keywords or just, make a fluke guess, that is. For example, if it's a 65-year-old with sudden tearing chest pain radiating to the back, before you even look at the choices, your brain should already be saying aortic dissection, isn't it? So then when you reveal the options, you're just confirming what you already know, not guessing. Okay. And then think of every question as a mystery. All right. Do a little Sherlock Holmes. The stem gives you all the clues. You just have to identify the key ones. Okay, look at the time course. Is it sudden onset? You want to think vascular. Is it gradual? You want to think infective or inflammatory. Okay, vital signs. Maybe they're off. So think about shock, sepsis, arrhythmia. Red flags. Do you see a drop in GCS, chest pain, limb ischemia? So phrases like hypertensive, distended abdomen, altered GCS, crackles, these are your anchors, okay? Train yourself to underline or just mentally highlight 2 or 3 key clues before moving to the options, okay? And then time being your biggest enemy, I would suggest doing the traffic light system. This way, what you do is basically, if you're confident it's a green light, mark and move on. If you're a bit unsure, flag for review. And if you have absolutely no clue, and there's absolutely no way you could know the answer if you don't know it already, make your best educated guess and move on. Do not flag that question, please. You're going to waste your time. Okay. You should never spend more than 90 seconds on a single question. Momentum keeps up your confidence. Okay. You'll often find later questions jog your memory for earlier ones. Okay. Now, eliminate the impossible. So when you're unsure, elimination, excuse me, elimination is your best friend. Okay. Ask yourself, does this option fit all the findings in the study? Would this option be unsafe or irrelevant in the ED, you'll often find that 2 or 3 options fall apart immediately. Like you'll be able to be like, nope, that's not the answer for sure. Once you're down to like 2, because that's where you usually get stuck, choose the one that's the most safest and ED appropriate. Okay? Because remember, RCEM will always value safe decision making above all else. So, like coming through from the last slide, safety always wins. When you're stuck between 2 possible answers, ask which one is safer in the ED. That's your answer. For example, if there's a shock patient with suspected PE, do you send a CTPA or thrombolize? Now, a CTPA might be logical in theory, but in practicality, it's unsafe if the patient's unstable because he is shocked. So you thrombolize first. So always pick the safe, stabilizing action, not the clever or academic one. Okay. Next, I have the 2-pass strategy. So here's how you structure your time. Pass 1 is when you answer all the straightforward questions, and that's usually like 70%. If you have put the work in, if you've done the theory, if you've done good revision, and you've trained your mind to do MCQs, by the time you get to the exam, well prepared, you should be able to do 70% MCQs. Now, this does not include those people who tried shortcuts first, who were looking for easy wins, and who were just practicing MCQs. You will find the paper hard. If you didn't work on your core skills, the paper will be difficult. If you worked on your core skills, you will find that you are able to answer 70% of the MCQs straightforward, very easy for you. The phase 2 or the pass 2 is when you come back the flagged ones with 45 minutes left. All right. So this prevents your burnout early on and gives you that maximum marks for your strengths first. Next is open relationship clues. Now, let's talk about something subtle but incredibly useful. Option relationships. Sometimes the way options are written gives away the logic of the question. If 2 options are opposites, for example, admit versus discharge, the correct answer is usually one of those 2 extremes. Okay? If 2 options overlap, like IV antibiotics versus IV ceftriaxone, RCEM usually prefers the more specific evidence-based one. All right? And if the option looks like steps in a sequence, for instance, do ECG, start aspirin, refer for PCI, then the right choice will depend on where you are in the pathway. Okay? So ask yourself, are we diagnosing? Are we treating? Are we referring? Like which part of the sequence are we in? That logic alone can solve many questions without memorizing a single fact. So do what you will with that information. I hope that helps. All right. Now let's come to like some of the common hot topics that are for sure going to be tested. And I would like you to revise these topics in like the last 10 days of your exam after building core basic knowledge. Okay. Now you can't predict the exact questions, but you can predict the theme. And these areas appear nearly in every setting. Why? Because these patients walk into your emergency department on a daily basis. In every shift, you're likely to see one. So in chest pain, you might want to cover ACS, PE, aortic dissection, especially because aortic dissection, they've updated the guideline. Sepsis and septic shock, there have been some changes in there as well. Peds emergencies like pediatric fever, the traffic light system, rash and seizures. Why? Because the guidelines have been recently updated. Trauma imaging and ATLS, especially CT head, the within 1 hour, the 8 hour, the pediatric guidelines, very, very important. Learn them, put them up as your phone screensaver, put them up in the toilet if you have to, look at that often, print them out and put them on the mirror in front of you just to revise them on a daily basis because you will get an MCQ from that for sure. Airway management and procedural sedation. Again, the guidelines have been revised, so they are going to put those there. Toxicology is for sure going to be there, specifically paracetamol, opioids, and TCA in some form. And lastly, ECGs and arrhythmias. You will have at least 4 or 5 ECG related questions in some form. Okay, master these themes because they will appear in every setting. If you know these themes, 60-70% of your paper will become very familiar to you. Okay, now I have devised a theme-wise rapid review kind of SBA session, which I am planning for January before your exam. And we'll see how we do with that. Maybe like 2 or 3 sessions on SBA themes so that we cover those topics in the last few days and you go through the guidelines, you go through what can be asked, like important guidelines that they have changed recently that can be in your exam, or important questions that can come. And these themes are basically designed by how RCEM thinks they're important and why are they important. Like I said, you see these patients very frequently on a daily basis in your emergency department. So we will get to that as well. So whoever is going for the SBA, stay tuned, get connected to the Golden Eye where you will see those themes come up in hopefully January. All right. Then you have, when in doubt, always just refer to the algorithms. That's my go-to. Okay. You can have any question bank, any course, anybody giving you notes. All of them can have mistakes. So the best way to double check whatever you're reading, have the algorithms, the updated ones, please, not the outdated ones. So I always suggest to candidates that please, you can refer to shortcuts all you want, but you can be learning something wrong just because they made an error. And they have this very fine print mentioning, oh, there can be mistakes in it. And so that's why I don't want you to learn the wrong thing. So keep the actual RCEM algorithm or the NICE guidelines or the recess guidelines with you, okay? So that you don't make mistakes. And always map each question to that familiar guideline or pathway so that you can just revise all of it. So if there's a knee injury, you can revise all of your knee fractures or knee related problems, the whole of it, whole topic like that. So that's how you make things if you want to do it on your own. Like Wells, Ottawa rules, you can revise those in the last days. NICE guidelines for sepsis, Nexus rule for C-spine. All of these are really important, especially because the RCEM examiners, they love algorithmic reasoning, okay? Because this shows that you are a structured, safe clinical thinker. And you know what the next step is. Everybody in the NHS works according to an algorithm. Even if you don't know it, they just pull it up and they follow it. So they expect you to be able to learn those algorithms and be able to reciprocate that learning in your practice. Now, the last one is a bit funny, but that's what it is. This one always gets a laugh because it is true. One of the easiest ways to score marks is to rule out the stupid option. Now, I know you're smiling. If an answer would make you look unsafe or negligent, it's wrong, obviously. Like, for example, discharging an unstable patient, duh, you're not going to do that. Giving oral medication when IV is clearly needed, you don't want to do that. Waiting for CT before securing an airway. Like, you know the GCS is less than 8. You'll have to secure the airway before going for CT. So these are kind of like the common things. So even if you don't know the correct answer, you can actually very confidently eliminate the dangerous one. And that will increase your odds immediately to be able to choose the correct one. All right. Now we're moving to the end. And if you've stuck with me so far, I hope you have a pen and paper out for these next few slides because I want you to note this down. When you practice questions, recreate the real exam conditions, please. And this is for like the last 2 weeks of your exam preparation. Set a timer for 3 hours, no interruptions, don't check answers as you go. Afterwards, review your mistakes in an error log, okay? To keep like the topic, what mistake you made, and then what concept you need to work on. And that's how you fix it. But don't just write what was wrong, write why you got it wrong, okay? Did you misread the stem in like a haste? Missed a clue that you were supposed to look at? Were you overthinking this? And this is also important for somebody who's giving the exam again. Look at your past mark sheet, see where you scored a bit low, and then try and work out what happened and then focus on those subjects and give maximum time to them to build those core concepts to be able to pass the exam this time around. Okay, so that's how you identify your patterns and turn your weak areas into easy marks. Now, reset and reframe. Sometimes during the exam, your mind will freeze. It's completely normal. You know, there's that time when you're looking at the screen, but you're not reading anything, everything's just blurring out, and you're just so done with life. Like that's how I like to frame it. That's what the mindset that I had when I was in the exam. When that happens, please just look away from the screen for 2 seconds, take a deep breath in and out, reread only the last line of the stem, and often you will realize that you were answering the wrong question entirely. Okay? That simple reset can save multiple marks. I hope you do that next time you freeze. Okay? Now, trust your first instinct. I cannot stress this enough. Okay? Research shows that your first instinct is correct around 70% of the time. So only change your answer if you found new evidence that clearly contradicts it. Okay? Otherwise, please don't second guess yourself because of doubt or anxiety. RCEM questions are designed to test clear, logical, first pass reasoning, not over analysis. You're likely, if you're overthinking a question, you are likely going to get it wrong. Now, one of the most common reasons people lose marks is misreading what's actually being asked. And this I see in like OSCE as well. Like they would misread what the station is actually asking for. So please watch out for these traps and the subtle phrases that RCEM uses sometimes, like next best investigation, not definitive investigation, the next best one, initial management, not definitive treatment, but initial management. Third one is like most likely diagnosis, confusing with cause of symptoms, okay? Not most likely cause, most likely diagnosis, okay? So always underline the action word mentally every time in your head. And that single word often changes the whole meaning of that MCQ. All right, so let's do a quick recap and summarize everything we've discussed. So, number one, predict before you peak, train your reasoning, okay? Eliminate unsafe or irrelevant options. Number three, always think like an ED doctor. Safety is always better than cleverness, always. Manage your time with the traffic light method. And if you can apply these consistently, your performance will rise dramatically. I can assure you of that. Final words from my side. The SBA exam doesn't measure memory. Okay. Well, that's not entirely true. It does measure memory because the DVLA questions come in the exam, but it also measures judgment under pressure, majority of the time. So stay calm, systematic, and safe. Treat each question like an actual patient. Stabilize first, think clearly, act logically. That's the mindset RCEM rewards. And that's the mindset you'll carry into real life emergency medicine. Thank you so much for joining me for this session. If you found this helpful, share it with your study group and follow Golden Idea for more high yield EM content, live teaching, and upcoming course dates. They will be updated either on the Instagram or Facebook, and maybe Substack at some point. And also you can reach me directly for personalized MRCEM questions, anything, you know where to reach me. You have the social media, you have the email address if there's anything you want. And obviously, like I said, we will be considering the SBA themes kind of thing in January that I'm looking forward to, and maybe an audio series that I was hoping to like put out in December to help all of you who are working and very busy and want something just to learn passively with. So best of luck with your exam. And remember, stay calm, stay safe, and stay clinical. And I'll see you all in the next session. Allah Hafiz. Oh, and if you have questions, just leave them in the comments below and I'll be answering them live and in the chat box later on as well. Thank you.